Good morning. It's Wednesday, December the 11th. I'm Lisa in for Lori and Corinne. All by myself today. Everybody's out doing other things, and so you get me. I thought we would talk about hand washing week, which was at the first of the month, and we kind of skipped over that. Our friends, Angel and Celeste at Coronado Healthcare in Phoenix, Arizona, that's one of our facilities, did a wonderful hand washing video that they said we could share with you. So we're going to watch that right now.
Show for CNAs by CNAs. I'm your host, Angel, and this is Celeste, CNA at Coronado Healthcare. And today is National Hand Washing Week, December 1st through the 7th. So Celeste here, she's going to show us the special techniques on how to wash your hands. You ready, Celeste?
I am ready. There's no special technique. You just do it the right way.
All right.
All right, we're going to come over to the sink. We're going to turn the sink on. First things first, we're going to wet our hands. Hands down. We're going to go for soap. Hands back down. We're going to wash our hands thoroughly.
How many seconds?
For at least 30 seconds, or some people like to sing happy birthday, and once that song is over, they're done. But we're going to make sure that we get in between the fingers, top, surface. You can even come up past the wrist. Fingernails.
Round of scrub.
Alright, I actually sang happy birthday in my head. I do believe that was 30 seconds. Now we're going to rinse. But be mindful when you're rinsing your hands. You want to rinse with your palms facing downwards. You never want to shake. Don't shake your hands. Never shake your hands.
Don't shake it.
And you reach for a paper towel. 1, 2. You're going to dry your hands completely. Get another if you need it. You're going to make sure your hands are completely dry. Toss, trash, paper towel, bounce it off, and that's hand washing.
All right. And there you have it. Celeste is the pro. All righty. So we'll see you next time on Let's Talk CNAs, where knowledge is empowerment. Woohoo!
This is Henry the Hand. You've probably seen him on the NAHCA Facebook page. It's a great graphic that kind of goes over the same thing the girls talked about in that video. That was a wonderful video, ladies. Thank you for letting us share that. Everybody needs to go like the Coronado Healthcare page and Let's Talk CNA's Facebook page. They do lots of really informative videos that would help you all. So go like them. They're great. Henry talks about how diseases spread. So as caregivers, you probably already know this, but infectious disease is spread through mucous membranes, so our eyes, our nose, our mouth. It's not necessarily what's going through the ventilation system. It's when we touch something and then touch our eyes or our mouth. So hand washing is so important. Now, especially this time of year, we worry about the flu. This is the CDC's flu map. You can get that on their website anytime. This one is dated November the 30th, 19, so it's almost, 2 weeks ago. So I don't know if they update that monthly or every 2 weeks, but the little note underneath it says that it has doubled since the last time they reported. So you can see your state and where your activity level is there. So it's very important to get your flu shots. I've had many questions about this. I've seen it on Facebook. I did a lot of flu shot clinics when I worked for hospitals, and I get so many questions about the vaccine. So there's lots of different types of vaccine. There is a nasal spray that is the only one that is a live virus. All the other shots are not. So you cannot get the flu from a shot. Let me say that again. You cannot get the flu from a shot. So many people are afraid to take the shot because they say it makes them feel bad. It may make you a little uncomfortable. It may hurt on your injection site. It may make you feel a little yucky for a couple of days, but that's no different than any other vaccine you get. Flu kills many people each year, many people, and the majority of them are children and older adults. If you are working with that demographic, it's important that you get your flu shot. If you live with somebody that is in those age groups, it's important to get your flu shot. You may not worry about getting the flu because you're a young, healthy person. But if you give it to somebody who is not, and they die, how are you going to feel? Don't do that. Don't put people in that situation. The flu shot is out there. It's readily available. If you work in the healthcare field, the facility you work for is probably giving you free flu shots. So take advantage of that and protect the people around you. So that's my soapbox for the day. We will be back on Friday to talk about holiday traditions, and Dane will be with me again, so that'll be a fun day. So tune in Friday, and until then, have a great week.